our webinar today. My name is Nicole Bahina, and I am Vice President of Community Partnerships at All Chicago. We have a large team of folks that are working diligently to put webinars like this together. We're also we've been a part of hosting DFSS webinars, and we're trying to keep our website updated and manage Slack. So these are the little things that we feel like we can do to hopefully make your lives a little bit easier during this really difficult time. But as you know, we rely on you to give us information about how we can be the best partners possible. And so if at any point today, if you have other ideas about things we should be doing, please go ahead and put them in the chat box. But just we want to extend a huge thank you to all that you're doing on the front line, supporting people who are in a really critical need right now. And we know that it's scary times and that it's just really difficult. And so we want to just give you a little shout out, and we think of you often, and yeah, it's a really difficult time right now, so let us know how else we can be supportive. Let's go to, well, actually, let me run through the webinar housekeeping really quick. So if you're having any audio trouble, we recommend just trying to switch between your computer and dialing in through the phone. So sometimes toggling back and forth or just shutting down and relogging back into the webinar can help if you experience any technical difficulties during today's session. If you want to go to the next slide, it seems like most of you have already found the chat box. It's a little button that you turn on the bottom that says chat, and you can toggle that on so that you can chat with everybody. Because of the large number of participants on the call, we typically try to keep everybody on mute, and that'll just help us all have a more enjoyable experience, but that doesn't mean you can't chat in the chat box. So please follow along, ask questions. If you know an answer to a question that somebody asked, please feel free to do that, and we'll try to lift up some of the most common things that we're seeing in the webinar as we go throughout. Next slide. Awesome. So we do have one way that we felt like we can make your all's lives easier by consolidating webinars. So we know that DFSS has a webinar and All Chicago has a webinar, and you're probably on like 13 other webinars a week. So we're going to make your lives a little easier by having one less webinar. And so All Chicago and DFSS are officially combining our webinars. So after today, the webinars will no longer be held on Mondays at 12, but beginning April 10th, the webinars are going to be moving to Fridays at 1. I think we're going to extend the time from 60 minutes so that we can make sure both DFSS and All Chicago can give as much, as many updates as possible, but at least you'll have a half hour back in your life. So that's going to be exciting, and we'll make sure that you have all the login information, but it should be the same going forward. Next slide. So the things that we've been really trying to do to help respond to COVID-19 are promoting cross-provider communication, securing financial resources, and distilling guidance from sources. So you will see probably the next time we come together that we're going to be doing a lot of work to help figure out how do we get people housed more quickly. And so that's something that we've been really working diligently on as a team here to figure out what that looks like. How do we help support the system to just move people more quickly into housing so that people are just in their own homes, be able to practice all the guidance from CDC as much as possible. And so we'll be looking to you all to help us figure out what that looks like as we go. Next slide. So here's our agenda today. We're going to start by updates from our partners, the Chicago Coalition for the Homeless. We'll talk about some new funding resources, updates from a lot of other COVID-19 areas, including CDPH, and some updates about PPE, CHA, FEMA, and the HUD Waiver. That we will always at least try to the extent possible, leave time at the end for question and answer and hopefully promote some peer sharing. And then we'll do wrapping up and next steps and talk about the webinar summary that we usually publish afterwards that we'll continue doing. Next slide. And with that, Mary, if you can unmute yourself. If not, I'll try to find you in the chat so that we can unmute you, but I think you're usually able to unmute yourself.
Yes,
hey,
I'm
Mary.
Here.
Yeah.
And is Mary Francis there? I am. Can you hear me?
Great.
Yeah.
We can hear you both. Thanks.
Okay, great. And you have my PowerPoint? Is that coming up next in the slide?
There might be a slight delay on your end, but yeah, okay, there we go.
Okay,
Perfect.
now I see. Okay,
Yep.
perfect. All right, we can change the slide. Thank you. So we're going to go over the main points of the CARES Act from the federal government. This is not comprehensive by any means, but it covers the things that are most important, that we believe are most important to the folks on this call. And just to be clear, we took a lot of this content from the National Alliance to End Homelessness. So if you're looking for any more materials, they have great resources. So the bill overall, for homelessness, there's $12 billion for HUD programs, healthcare enhancements, individual payments, small business loans, unemployment insurance enhancements, state and local government support. It's in total, it's a $2 trillion bill, most of the money is there to support private businesses, but there is, like we said, a substantial amount for federal, state, and local governments. And at that website, you can find a comprehensive list of everything that's in the bill. Next slide. As far as homelessness funding in the CARES Act nationally, billions are going to go to ESG and CDBG that can address homelessness to some degree at least. Funding, so the funding that's for homelessness is obviously for people experiencing homelessness, but then also people who are at risk of homelessness, up to 50% of the area median income. There's increased flexibility in the Act, allows for minimal decision-making process, no shelter cap, no match. Costs that are already incurred may be reimbursed. And for temporary shelter, there's no environment or that's not a word. Habitation review. I don't know. I'm sorry. I'm not sure what that word is supposed to be there. And then they advance the housing first model. So that's also really great, as we all know. Next slide. So ESG, you all are familiar with ESG. Of course, that provides funding for shelter, short and medium-term rent, and supportive services. We at CCR are trying to figure out exactly what that could be spent on. We're going to talk about this more, but basically we're really trying to advance as much as we can solutions for permanent supportive housing. So we need to see, what exactly is medium-term rent and how could we connect that to permanent housing solutions using ESG funding. For ESG in the CARES Act, $24 million is coming to Chicago. Next slide. And then there's CDBG, which are formula grants to state and local governments for a broad range of uses. $47 million is coming to Chicago. It could be spent on a lot of different things, so we need to figure out how much we can get to be dedicated to homelessness. The city and the county and the state decides, but as far as who at the city level, we also need to get clarity on who exactly the decision makers are going to be. So we're in the process of figuring that out as we speak. There will be increased flexibility, no public services cap, and we're still trying to figure out the timeline for distribution, but within 30 to 60 days is what we're thinking. Next slide. I'm going to hand it up to Francis.
Hi, everyone. So this is an example of a way in which we're seeing the state be really creative and broad thinking in how we're addressing this crisis. So because Medicaid funding isn't typically used for housing and homelessness related purposes, or at least in a direct way like this, this might be a new process to many of the folks on the phone. So typically, with Medicaid, there are the federal, there are outlined federal purposes for which your state can use Medicaid funding. And if you go outside of that, you can still possibly use funding for things that are outside of those bounds, but you have to get what's called a Medicaid Waiver to do so. So the state has recently submitted a what's called an 1115 waiver to expand what can be, essentially what services can providers can bill Medicaid for. So among many other things, the Medicaid Waiver request that was submitted by the state to the federal government at the end of March is funding for temporary housing for people that are experiencing homelessness. Now, this is temporary housing. It only would cover, basically, providers could only bill Medicaid for the duration of this crisis. So it isn't a permanent solution, but it's still, a great step by the state to request that. And this waiver hasn't been approved by the federal government, at least not so far as I've heard, or the last I checked earlier today. But we're waiting for that decision, and we expect it to come down somewhat soon. Next slide, please. Another funding source that we know is coming is the HOPLA funding, which is a federal grant that can be used for for services for people living with HIV/AIDS who are experiencing homelessness or housing instability. The two entities in the state that are to receive these HOPLA funds under the CARES Act are CDPH and IDPH. We're expecting about $1 million of the funding to come to Chicago and Cook County. This funding bucket is smaller than the other ones that we've discussed, but it's still very important and is targeted to an extremely vulnerable community in light of this crisis, particularly. So these are one-time new funds. So it's going to be difficult to create permanent housing just from this, one-shot funding. But with that said, we should continue to advocate for more funding in the next federal relief package that we expect to happen. And also this will hopefully bolster our other, the funds available from the other sources. So it can be used for a wide range of services: housing, social services, program planning, developmental costs, and the timeline that we expect to see these funds come down is actually legislated into the CARES Act. So they, these funds are coming down relatively quickly within the next 30 days. Next slide. I'll toss it back over to Mary. I think.
And Mary, you might be back on mute. Let me see if I can find you in the attendee list.
Sorry about that. I forgot to mute myself.
Hey.
Thank you. All right. So I was just saying that, there's a million different ways that the government could decide on, how to actually spend this money to address homelessness and COVID-19. So what we're proposing is that the money that the city receives from the federal government that could be spent on homelessness would be spent largely on quarantine and isolation housing for the most vulnerable, and that quarantine and isolation housing that would be provided for people experiencing homelessness would be provided in the form of bridge or rapid rehousing, with the goal of securing funding to make the housing permanent rather than putting people into hotels. Now, of course, there will need to be a ramp up so that, because we don't have this bridge housing available yet, but the idea would be to move toward that as quick as possible. And I'm going to talk in the next slide about why this is our proposal. It's much more cost effective, especially since this crisis could last a long time, until there's a vaccine. It's about 5 times cheaper for a night to put someone up in a hotel versus it just in an apartment. It can help more people since it's more cost effective. We think it's safer too. We're actually going to be talking to doctors to confirm that, what we suspect is true, that, moving people around from, the shelter to a hotel, back to the shelter is just, it's not as safe as just putting people into a housing unit where they stay put. The other obvious issue is that, when someone recovers from the virus, who's homeless, at the end of their stay, then they just go back onto the street or back into the shelter. And so this is an opportunity with new funding from the federal government that we see an opportunity to provide people with what they really need so that they're not entering back into homelessness. And, we understand that All Chicago is very much on board with this proposal, and we really look forward to working with you all to make it happen. So the next slide. As far as what we will need to do to make this happen, we still have a lot of information that we need to collect. We don't even know who's deciding how these resources are spent. Are there landlords who are renting right now? We're hearing that they're not because of the challenges with showing units and gathering together to sign leases. There's a lot of issues with that, so we need to work through those. Who would implement this? Who exactly would be prioritized for the PSH or for the bridge housing in the first place? We would want to work with all of you to work through those questions and concerns. We'll have to come to agreement with the decision-making bodies that this is how the money should be spent and to work out all the details. And then on top of that, we'll want to work in collaboration with groups around the country to fight for this funding to become ongoing, because we don't want to put people in housing for a few months and then they all end up back on the street. So we need this funding to be ongoing so that this can truly be permanent housing. Next slide, please. Yeah, so we were hoping to get your thoughts. I'm not sure how much time we have left in our presentation, but if you have any, and I do see there are a couple questions, so maybe we should actually have Mary Francis answer the Medicaid.
Yeah, sure. Yeah, I saw Michael's question in the chat. My understanding is that it would expand what services can, what you can bill to Medicaid. So it would expand that ability to bill Medicaid to agencies that haven't traditionally done so. I'll get confirmation on that, and if I hear differently, I will get back to you all.
Yeah, so if there are any, if you all have any feedback on this general proposal or things that we may not be thinking about that we should be thinking about as we're working to advance this proposal, please just put those in the chat box and we can keep track of those. And yeah, if there's, you can email me if you're interested in joining, but I know All Chicago is going to be very much involved in this too, so this is a little bit outdated to email me because, we're all going to be working together on this plan. So if there aren't any questions, I do see Michael said, how will that work?
Mary.
Oh, go ahead.
Yeah, we don't have a lot of information on that yet because and I don't know, is there a way to send documents around to the group?
I think you can email me.
Yeah, I was just going to say you can email them to Jennifer, Torlin, or myself, and we can get them out to the group. You can also attach them here, I think, and send them through the chat. And I know, to Michael's point, the Medicaid waiver is a great solution for agencies that already bill Medicaid. I know the process to become a Medicaid billing agency can take, up to 2 years, so it's probably not like an immediate solution for agencies. If you're one of those agencies on the phone sitting here thinking like, oh, great, now I can just become a Medicaid billing entity, it's probably not the case, but it is a really good solution because there are several agencies that already are doing that.
Right. I'll send a link in the chat to the waiver request, and I've reached out to my colleagues that are, on the ground advocating for these waiver services to be approved to see if they have resources for folks who don't traditionally bill Medicaid. But I think that you're right. It's going to be a better solution for people who are already plugged into Medicaid billing, which is a lot of, providers that are on this call.
If I could just address Fred's question with lived experience, it's a really quick answer. We have an organizing department that works directly with people who are currently experiencing homelessness or previously have experienced homelessness, and have a leadership team who is absolutely part of the decision making as far as what we work on as an organization and helping us move forward our campaign. So they will be very much a part of what we're doing.
Thank you, Mary. I know I was just going to say that this morning, the All Chicago and Coalition had a call about connecting on this work, and as much as possible, we're going to be, using our COC implementation structure, which is the action agenda, to run as quickly as we can through anything new that's going to happen. So any funding decisions, all of that, we're going to try. It's hard because it's a little bit of a bureaucratic process that we've set up, but the reason that that's important is because it's the right structure. We have all of the right people already at the table. We have leadership groups that are used to making decisions. So we'll be in touch soon about sort of more decisions that are going to come out of this. And then for people who are on the call, I haven't reached out yet to the Continuum of Care board. But if you're curious about whether the board is going to be meeting this month, they are, and it's going to be a virtual meeting. The executive committee just made that decision on Friday, so we'll give you more information about how to listen in on that meeting as well. Great. Anything else, Mary or Mary Frances?
Well, there were some other questions on the chat, but I don't know how much time we have.
I think we probably, if you want to try to address some of them via chat, that'd be great, but we probably do need to move on just because of time. Yeah, thank you. Great. All right, so if we can move on to the next slide, I wanted to make sure people know about the Paycheck Protection Program. Our CFO basically said everybody should be applying because it's a loan that is essentially forgivable if you meet the criteria. So it's kind of like free money. So there's more information that we can drop a link in the chat box. If this was not already on your radar, please make sure somebody at your agency is responsible for looking into this and seeing how to go about applying. Next slide. Great, and so I'm actually going to turn it over to Margaret, who's going to talk about our agency emergency fund.
Hi, thanks, Nicole. So I'm just going to share a couple of points related to the Chicago COVID-19 Homeless System Agency Emergency Fund, which we talked about during the last webinar last week. So the first round of applications were actually due on April 3rd, which was this past Friday. So thank you to all the agencies who sent in applications for round one. Our goal is to send out funding notifications the week of April 13th. So I just wanted to share that information about the timeline. I also just wanted to share that we are working with an advisory committee who's assisting with guidelines to aid All Chicago's decision-making around this fund. And this advisory committee the makeup of this advisory committee is modeled on the COC board stakeholder structure. So we have been putting together guidelines in order to aid the decision-making that All Chicago will need to make regarding this fund. We hope to provide round two information as soon as possible, so be on the lookout for that. So that's essentially the update that we have related to the agency emergency fund. So be on the lookout for more information. We'll provide information as it becomes available.
Great, thanks. So if we can move on a couple slides, I'm going to just summarize some of our key points from DFSS's webinar that they hold, and the webinars with the Chicago Department of Public Health from last week. So we do this because we want to amplify the messages that we're hearing at the other webinars, and in hopes that it will provide some at least continuity with what you're hearing, or answer some questions that you have. So we can't promise we can answer any questions about these next couple slides, but what we can do is take the feedback back to CDPH and DFSS if there are questions we're not able to answer. So that said, if you do have questions about isolation or social distancing protocols, CDPH has a hotline. The number is here. You can email, and I know they respond fairly quickly, because a lot of times they'll call us and ask us for information about how to respond, and they have a great team working over there. And then, you know what, Torlin, would you do me a favor and try to mute some of the background noise that we're hearing? I think there's just a couple people who are unmuted, but I don't have ability to do that. Thanks. So the CDPH guidance for homeless shelters is a great resource. If you don't know, if you haven't read that already, you can review it, and I think Jennifer just dropped the link in there as well. And to my knowledge, I don't think anything's been updated since the last time we talked about this. So if you've read it at that point, you don't need to review it again. Next slide. Okay, so last webinar we had a lot of questions just about, is 311 working? How are new people getting into shelters? So here's some information that might answer some of your questions. So 311 is taking referrals. The majority of new referrals are routed to the temporary shelter facilities that are new. And you can call 311 from any address, but please, if you do not send clients to hospitals or police stations, because they will be turned away, unfortunately, at this point. And there are places for people to wait at the DFSS community service centers. And so you can, if you just Google Chicago DFSS community service centers, all of the names and addresses pop up if you're looking for a place to refer someone to. And transportation is still being provided, but at a reduced capacity, just due to reduced staffing resources like we're all experiencing. Next slide. So there is a supported isolation facility that's going to open with at least 100 beds for people who are COVID positive with behavioral health needs, and referrals for those are coming from hospitals. So probably not something that you'll be able to refer directly to, but just know that it's there. And then a pilot is starting for shelter and outreach-based referrals for testing, isolation, and quarantine, and people with symptoms are transported to the facility for testing. People who test positive are referred to an isolation facility. Next slide. So CDPH is investigating all reported cases from congregate settings. They're asking shelters to report when they have 2 or more confirmed or suspected cases of COVID-19 among residents or staff using the case reporting form, and we can drop this into the chat box as well. And then I do see a couple questions on the side about the PowerPoint being available, and we do provide the slides through our Slack channel, and we'll have more information about how to join Slack if you're not already on there. Great, next slide. So some of you may have been one of the recipients of the PPE Delivery on Friday, and so just because I know people kind of like hear through the grapevine that things are happening, I just want to be really clear on how this came to be. So All Chicago was part of a large group of people that were working on this, but PPE was prioritized for the crisis response system that delivers services in a congregate setting to an evolving group of people. There is limited PPE in the whole entire country, and so we don't have new stockpiles of PPE that we're kind of hoarding and then deciding who it goes to. Or, if we hear about it, we try to help influence the strategy around how it's delivered, but that's not really going to be the case going forward. So to the extent that you can extend your PPE as much as possible and follow the CDC guidance on that, obviously I think you're all probably doing that already, but that's what we'd be recommending. And then we do have, sorry, I have a toddler who's coming in, as you all know what that's like. So personal, or can you go to the next slide, Denise? So today there is a Westside Homeless COVID-19 Response Workgroup webinar at 1. It went out in a newsletter this morning, and we can share the link for joining that. And And so we encourage you to do that if you want to learn about what this group has been accomplishing and or help create connections toward building similar networks in other parts of the country. Next slide. Great, and then I'm going to turn it over to Karen to do some updates from CHA, which is great timing.
Thanks, Nicole. I was worried you weren't going to introduce me for a second. Good morning or afternoon, everyone. This is Karen Cowell from All Chicago. The next few slides were provided to us by CHA. We did chat with them last week about how things are going, and like everyone, CHA is absolutely doing the best they can to manage, this crisis and help residents in their units. They did want to make clear the use of CHA housing for the coronavirus, although we know that, and this is their statement on the slide, we know that there are a large number of units in the city from CHA, but at this time they're not contemplating using these units for the COVID-19 crisis. Any units that we hear that are available are generally not habitable, so they are using all their units to house people. So if you can go to the next slide, please. So just some high points of things we learned and discussed with CHA, and again, they provided all these points to us. So the health and safety of all the residents in CHA housing is their top priority. They've been providing ongoing communication for any resident in CHA housing regarding the coronavirus and the shelter-at-home order. And these documents are available in a variety of languages to help residents, especially they're very concerned about seniors. We all know there's a high level of seniors in CHA housing. CHA does have the expectation that they will continue to house people, and most of CHA's work is done remotely, like many of us, where it's either done over the phone or over email, and CHA staff can access any information they need remotely. And so CHA is continuing to conduct interviews for those who are in the public housing process. Next, any project-based building, they will still continue to receive wait lists to fill their units, so you should continue to utilize the regular process to request those. Inspections are still occurring, mostly for emergency and new move-ins only. They are allowing property owners to self-certify for biennial re-inspections and quality control inspections. So, if you have like a renewal, you don't have to wait for an inspection for the most part. And then finally, CHA has communicated with their residents regarding rent deferral until the stay-at-home order is lifted. The residents will be responsible for April and any subsequent month that the order is in place. The last thing, Mary Howard and her team were great about talking to All Chicago. She did request that to collect questions you may have. So if you do have any questions for CHA, please feel free to put them in the chat, and we will collect those and send them over to CHA so they can start addressing them if they aren't addressing them already. Next slide. So I think I'm the next one too. So the last thing I'm going to talk about today is the HUD waiver. As many of you may be aware that HUD issued a waiver. They actually issued it on March 31st, but they announced it publicly on April 1st, so it's in effect. The memo is in effect as of March 31st, 2020, and there's waivers available for the Continuum of Care, the Emergency Solution Grant, and the HOPWA, Housing for People with HIV grant programs. Myself and my team, are going to facilitate a Q&A about this today at 3:30. This might be super short notice for some of you, but we will, of course, record it and post it on our website afterwards, so I hope some of you can join us. It will be pretty heavy on COC focus because the COC has the largest number of waivers and the largest amount of direct grantees. So waivers can only be applied for if you're a direct grantee of HUD. So I think I'm done after this one. Thank you.
Hi everyone, this is Max Burns. I'm with All Chicago. I'm a program coordinator, and this is just a quick public announcement or like awareness announcement about this particular funding stream that is provided by FEMA. It's the Public Assistance Program. It's only for agencies or entities that are nonprofit organizations that operate facilities. So that's one caveat, or if a facility provides an eligible service. So if you have a day shelter, perhaps this might apply to you. Jennifer just posted in the chat information about this particular program, but the short and sweet of it is that the National Emergency Declaration is really expanded or has allowed for COVID-19 response-related costs to be, applied for reimbursement with this program. It is a reimbursement-based grant that is administered, or not grant, grant, by FEMA itself. So for additional information, go to the link that Jennifer put in the chat. They'll have kind of a programmatic overview there that you can read, as well as some good YouTube videos if you dig around the website. So thank you very much.
Thanks, Max. And so we are getting to the Q&A/peer sharing part of our webinar today, but before we go through some of the questions that have been put in the chat, I think Jonathan and Denise are going to talk through our slack.com channel and pose a question to the group. And the reason we're doing this is because we want to remain responsive and continue doing things that are helpful, but also sunset things that people are sort of, as things evolve, maybe things are no longer helpful anymore, and so we want to stop doing those. So with that, I will turn it over to them.
Hi, everyone. Thank you, Nicole. So this is Jonathan D. with Small Chicago, and I wanted to provide some quick updates regarding the COVID-19 response Slack channel. So we've been working on an FAQ that we will not only be sharing on All Chicago's website, but also be held under the Provider Questions channel on Slack, which contains responses to questions we receive in webinars, the Slack channel, and through individual conversations. And then the next thing I wanted to address is the new centralized resource document that we've posted on the resource channel. So our hope moving forward, the document will contain all of the resources we received, and just something to keep in mind, as if you've posted something to the channel and you're coming back to the thread and you can't find it, don't worry, it's not gone. I've probably already moved it to the resource document, which I hope to have updated and posted by the end of each workday. And then, of course, the announcements channel has been streamlined to only include federal, state, and local measures, and the webinar summaries channel has been streamlined to include all links to webinars that we are following. And the next slide, please. All right, so now before we go, we want to ask people's help by conducting a simple one-question poll. To do this poll, we're going to use the chat function in the webinar. So to answer the poll, type either yes or no in the chat, and then afterwards we'll do a final tally of the results. All right, so what we want to understand better is how people are using the Chicago COC Slack channel. One of the Slack channels is titled Webinar Summaries, and on it are short summaries of a variety of COVID-19 related webinars, such as those held by CDPH, DFSS, and HUD. Our poll question is, how do people feel about these summaries? Please answer yes if the summaries are helpful or you plan to check them out soon, or answer no if the summaries are not helpful and it's unlikely that you check them out soon.
Ooh, this is fun. Fun to see.
I'm just going to copy and paste that and put that in there for them.
And then while the responses are coming in, we can be, I don't know if any of the other All Chicago staff on here want to either highlight any questions that are coming up, or if there was a question that was a great question that we answered that we should probably talk through as well. That might be helpful. I know as a participant, it can be really hard to both follow the chat and listen to the presentation, and so it's always good to go back and kind of highlight some of the best, most applicable questions that we've had.
Hi, Nicole, this is Doug. Can I say something?
Yes, please.
I just wanted to highlight on the same subject of that webinar summaries. We're also doing our best to put forward a bit of a summary of what webinars are coming up for the week with links to those. Obviously, that's a very real-time evolving thing. So we will do our best with that, but you can also look to that channel to check out kind of a consolidated list of what COVID-19 related webinars are coming up for that week.
Great, thanks. And I also saw Kathy put, so I'm looking just to see if there's a setting we can change, but if not, then it's even more important that we kind of highlight some of the questions that were asked, and we can talk through some of the answers that were given as well. Is there anything else, all Chicago staff, that we should lift up from the chat box or spend some time on? Give us a minute to scroll through all of the poll.
Hey, Nicole, I thought I saw some questions pre the poll about coordinated entry assessments, and we did, Stephanie might be on, I'm not sure, but I believe all new assessments are being done over the phone now, and I know someone particularly asked about Matthew House. I don't know if Sherry or Dr. Simpson want to put in the chat box, but I believe everyone's doing remote CE assessments, but if you're not Matthew House, just let us know.
All right, so give us a couple minutes here to just scroll back through the chats. Karen, was there anything else that you answered via chat that we should lift up?
No, I think there was just a lot of tech questions early on that I was helping people with. But thanks for all the CHA questions and comments. We'll definitely be sending all of those to our contacts at CHA. I think was all great feedback to get back to them and questions as well.
So a couple of people are saying if they could get more information on the phone number to call for assessments. Oh yeah, thank you, Anthony, for bumping your question. Yeah, if anyone has questions that we didn't address, please put them back in the chat and we can keep talking through them. Yeah, thanks, Jessica. So Jessica dumped the call center line in there. I linked to CSH's website about coordinated entry where they update it. They just updated it today. So I think that's going to be your source of the most updated info, although we frequently have CSH folks on to talk about coordinated entry too, and we can do that next time if there's important information to report back. So Anthony is repeating the question that he brought up on Slack last week about a few folks who are receiving similar feedback to what he's experiencing, that individuals are calling 311 looking for emergency shelter and told that there are no beds available. I don't know if anybody on the call from All Chicago staff knows about that. If not, it's something we can add to our list with DFSS, or if anybody else on the call has an answer to that. Are other people experiencing that as well, that you call 311 and are being told there's no shelter beds? Give people a minute to respond. Okay, a couple other people are saying yes. Okay, so maybe it's a miscommunication between CDPH, DFSS, and 311, so we can make sure that we give that feedback to DFSS. And Jennifer, will you, just because I'm looking at the chat box right now, but will you help me remember to add that to our list of questions for them? Great, Betsy's reporting that.
Yep, I will.
Thanks. Betsy Carlson says that we've been told that there isn't pickup available after 8:30, and she's reported that to DFSS. Yep, a lot of people are saying the same thing. Okay, so it seems like it's a problem that not just one or two people are experiencing, so we can definitely give that feedback to DFSS, and then if there is an answer, provide that in Slack or on the next time that we talk. This is one of the other things that we're really excited about, to combine webinars with DFSS, and CDPH always joins those webinars as well, because it's then we don't have to be the middle person, and we can get direct answers and give direct feedback on the webinar as well. Okay, so I'll keep scrolling through the chat, but if there were any other questions that people want to put back in the chat box that we might have missed earlier, let's do that now.
Hi, this is Jennifer. So we do have a question from Angelica about when the agencies will hear back about the agency emergency fund. And if Margaret, can you remind us of that date?
And I just want to, oh yeah, go ahead, Margaret, please.
Go ahead. Okay, yeah, sorry. Yes, so we're expecting to provide funding notifications the week of April 13th, so that's not this week, but the following week.
Great, and then Michelle put in a note about calling 311 to access some of the state homeless prevention funds. So most of you probably know that All Chicago is the administrator of those funds, and we do that through our partner agencies. And 311, basically 311 is getting extremely overwhelmed by calls for all types of assistance, as is the Homeless Prevention Call Center. So 311 will likely refer people correctly to the Homeless Prevention Call Center. Catholic Charities that runs the Homeless Prevention Call Center is doing everything they can to ensure they are staffing up, and they are adding staff capacity, and All Chicago is trying to help facilitate this as much as possible to make sure people don't have long wait times. I've been impressed by some of the things they're doing just to remind people that you might have a long wait time, but if you don't have, maybe call back another time, or can you fill out this pre-online assessment to just determine whether you would be eligible, and if so, then call back in. So they're doing everything they can to just pivot and be able to respond to the crisis, and we have calls with them on a regular basis to help figure out how do we increase their capacity even more, because I think we all know on this call that requests for assistance are only going to increase, especially over the next couple of months. So we're actively working to improve the capacity and the experience for people who are calling in. Michelle, I have the same question. So for people who can't see the chat, she said, is there a way to direct clients directly to the call center and not through 311? So I have the same question, and like I said, we're meeting with them regularly, so just to kind of troubleshoot and try to make the experience the best it can be for clients. So I like that suggestion, and we can definitely bring it up. Okay, so we'll keep the chat box open, but just in case people want to start dropping off, just a couple of reminders that we always post the slides and a summary in Slack. Denise, you want to go forward a few slides? Oh yeah, thanks. So we will post that webinar summary, and I think we post the slides as well. So check Slack for that. Did we drop in the chat box, or can we drop in the chat box just one more reminder about how to join Slack for those who are not already involved? Great. Thanks, Jennifer. So the Slack channel, a shortened link has been put in the chat box just by Jennifer right now, and so please join if you haven't already. And I guess the next time we will come together will be Friday, which I know is Good Friday, but it is not a city holiday, and even though all Chicago staff are off, we've committed to still being a part of that because we know that COVID-19 does not take a holiday, and so we are committed to helping make that webinar a great one, and I'm glad that it's finally come together so that you guys don't have to sit through 2 separate webinars. Great. Venetia, you can't see the chats, so I think that's what we were saying, is that there isn't a way for us to share the chat, I don't think, although someone had said click the talk bubble near the top of your screen, so I apologize that I don't know enough about the technology to help you turn that functionality on. I always do take a screenshot of the chats, and so we can, post anything that's sort of helpful as part of our webinar summary, so that will maybe help people feel like they're not missing out at all, so we can make that available. All right, so thank you again, everybody, for just all the work that you're doing, and continue to let us know how we can be helpful with you all, and we'll see you on Friday. Bye.